Okay, for some reason, my Canva is not letting me download and record. Um, so we're going to do it this way. So this was my project on Group B Streptococcus without antibiotics and prophylaxis, a systematic analysis. And for the first part of my project, I was assessing a pregnant person coming in at 37 weeks, 29 years old. They present with routine prenatal care and they test positive for Group B streptococcus on the swab. And they're healthy, they've had an uncomplicated pregnancy, and they're now expressing concerns about the use of antibiotics during labor. The midwife or I explain all the standards recommended for intrapartum GBS infection. Sometimes and then of course explaining neonatal GBS infection in severe sepsis that can happen, pneumonia, meningitis in the baby. I provide all this evidence, alternative support, and then ultimately my client does plan to get the intrapartum antibiotic prophylaxis if the labor occurs before 41 weeks, but they request additional discussions if induction becomes necessary. My clinical question ended up being, in pregnant individuals who test positive for Group B streptococcus, how effective is intrapartum antibiotic prophylaxis in preventing neonatal GBS infection compared to no antibiotic treatment? I acquired the information by using a number of websites. I used the school's Ovid Medline, the Cochrane Library. Evidence-based birth was particularly helpful, especially in the subject of GBS. There was not a lot of research without antibiotics. There was, however, a lot more peer reviews on, substituting antibiotics with probiotics. Ultimately, my keywords that I ended up using were antibiotic prophylaxis, neonatal outcomes. Once I applied the filter, I also used mesh terms like Group B streptococcus, and then of course articles comparing intrapartum and antibiotic prophylaxis versus no treatment, with a focus on neonatal outcomes and particularly the GBS related infection. Then I applied the material. This is my first article. It was probiotics. The systematic review directly examined probiotics in reducing Group B streptococcus colonization during pregnancy, which aligns with the clinical question. The meta-analysis approach offers a comprehensive synthesis or evidence from multiple studies, increasing the relevance of the evidence-based practice for the article. I do feel it was relevant. It was a high quality study and it had a comprehensive methodology. I liked the systematic and the meta-analysis approach, followed with the structured process that it used, including clearly defining inclusion and exclusion criteria. And then, of course, it was also from a reputable peer-reviewed journal. This was the second article. I do believe that it was also very necessary. This study evaluated the impact on oral probiotics reducing antepartum GBS colonization, offering clinically applicable evidence, and it included randomized trials providing high-level evidence on efficacy and the safety of probiotics. I do feel it was relevant. I liked the randomized control design, it minimized the bias and it allowed more for a comparison between the treatment and control groups. There was the study specifically targeted GBS colonization along with gastrointestinal symptoms. So they found that not only were people who were taking probiotics antenatally were being helped with lowering their chances of getting GBS, but they also found that it was lowering gastrointestinal issues, which obviously are key considerations for pregnant individuals. So you get that added benefit. And then ultimately, the specific focus on GBS colonization were key considerations. So the third article was more of a group of articles. I went to evidencebasedbirth.com and I typed in GBS without prophylaxis and antibiotics intrapartum. Not only does it have the articles that I posted here for my project, but it also gives a comprehensive review on the topic. It also gives you more than one resource to look up on with evidence-based information, and it also has a podcast that is really relevant to the subject. It was clearly documented, and it also includes really wonderful statistics and data presenting, and it has an easy to follow format. You just go to their website and it has everything there, including handouts that you can also print out. So the research does absolutely show a benefit. It demonstrated the benefits of intervention in the first article, the Senate intervention with probiotics rather than antibiotics in the first article, and in the second article, again, focusing on the evidence with oral probiotics, not only helping with the GBS colonization, but infection, but also having an effect and producing outcomes with positive outcomes with gastrointestinal systems as well. And in the third article, again, with a focus on GBS and giving really good data and easy to read material. The benefits outweigh the risks. When it comes to probiotics and versus antibiotics, you've got minimal side effects. They promote healthy microbiome in addition to potentially reducing GBS colonization, and the intervention may reduce reliance on antibiotics. So I do plan to treat my clients with probiotics first and hoping to go from there, not negating antibiotic prophylaxis use altogether, but maybe using a more natural route as a first line of treatment, and then maybe even testing again before labor. The secondary assessment tool approach was to evaluate the probiotic supplementation as an intervention for reducing GBS colonization. GBS colonization rates conduct regular GBS cultures during prenatal visits. And then, of course, maternal neonatal tracking neonatal outcomes, checking the database, and then always making sure that I'm getting client feedback and satisfaction surveys. So practice-wide review of the interventions and conduct periodic audits so that hopefully we can analyze the trends in the uptake of probiotics versus antibiotics. And then these are my references. So ultimately, I still believe very strongly in this study. I believe that I have found some really good tools to give my clients, as well as evidence-based information showing them another another choice for possible GBS infection. Okay, guys, thanks so much.